It's these Hollywood images of an Ebola outbreak that incites fear in the public.
In 3 months, it's 1 billion.
The CDC says it's confident it will stop the deadly disease in its tracks, sending alerts to the nation's hospitals. UAMC is ready, but doesn't expect to see it. Dr. Sean Elliott, an infectious diseases expert, explains why the Dallas patient is not a real threat.
He had no elements of being contagious while in flight or even in transit through what we presume was DFW Airport. So there's no way that that contact can have any implications for Tucson, Arizona.
But even in that slim chance, UAMC is looking for signs: headaches, body aches, coughing, sore throat, and high fevers. Anyone with those symptoms will be asked if they've traveled to Africa in the last 3 weeks. Dr. Ronald Poost has worked in the hot zones in Africa.
Infectious diseases, if you can find the contacts and keep them under surveillance until the incubation period is over, which is unfortunately 21 days, then you know you're going to be able to contain the outbreak.
So patients who show up at UAMC and are suspected to have the Ebola virus will be taken here into the decon room
to be decontaminated before being whisked to an isolation room. The message Dr. Elliott wants to drive home: the public shouldn't panic.
So you don't fear this?
No. Yeah. It's very easy with proper precautions to avoid getting infected by this. That's the major issue which we need to address.
Now, the best thing you can do, simply wash your hands just as you would do to help protect yourself from a cold or flu. It might help to know that experts say Ebola doesn't spread nearly as fast as depicted in Hollywood movies. Reporting from the newsroom, Valerie Cavazos, KGUN-9 on your side.
Thanks, Valerie.